So I have more of a comment kind of question.
I heard English, so I know.
Yeah. First of all, I really enjoyed all your presentations. They're fantastic. But so I'm working on a project now, a book project, and it's looking at sort of distance between, looking at ways to address the sort of rhetorical distance between physicians and African-American male patients. So your project really sort of...
Can you speak louder? Like,
I'm sorry.
Use the mic up there. There you go. It's not that awesome. What hear you say?
Grab the microphone. So I'm what I was saying is that the last presentation really hit on my project that I'm working on, and then also something that's something that's just a very concern of mine. And so I'm working on a project that is looking at ways of addressing the distance between physicians and African American patients. And so this sort of falls into that place. So then, so I just want to say a little bit something here, then there's a question that's going to follow here, which is, so when I was in graduate school, I was the only African American male in my graduate program. And it was stressful as hell. It was just a very, very stressful thing because it's just a very alienating, I don't want to go into it, but it's just a very alienating sort of experience to be the only person. And for women, just imagine being the only woman working in a particular company or so forth, or department, and you get what I'm talking about. When I was in grad school, I would go to the doctor, and I remember the doctor would say, and this is the campus, the university, right? Your blood pressure is so high. and I used to think to myself, yeah, because I'm stressed the hell out. But at no point did a doctor ever talk to me about stress, hypertension, and all those sort of things. So then here's my question, is that are you doing anything to work directly with maybe the University Hospital here or another hospital in terms of sort of trying to kind of put your research into practice or something like that?
So I definitely think that it's something that I want. Can you all hear me? Or I can't stand up. Yeah. So putting my work into practice is something that I want to do more of. I do other work around stress, so I do work on women who have incarcerated partners and similar questions. Are these the kinds of questions that practitioners are, and how can we incorporate these into sort of, to operationalize this? So the short answer to it is no, but the longer answer is to yes. And I think it's part of what I want to do and kind of where I'm moving towards. I'm a sociologist, but try to be interdisciplinary, and so I'm moving in that direction. But I think it's exciting that you even see sort of an application to ways in which this could be worked to be sort of inform, the patient-provider setting. Because I think it's something that's pervasive and definitely a stressor that can lead to health outcomes. Sorry, don't be disappointed in me though.
Not at all. Yeah, I got mine.
Yeah, we can work together.
Yeah.
So once again, I have the bizarro converse version of the question that came before.
Okay.
I know that I've experienced all of the same things. I'm in graduate school right now, and I'm experiencing them as we speak. But I'm happy to say I'm not the only black person in my department, so that's good. At least, but I was for a while there. But I've noticed something, and here's the converse, that you sort of have to do this respectability politics stuff when you go to the doctor. It's almost like how people get dressed to go to the mall. Like, I want to wear sweatpants when I shop for clothes. I don't want to have to dress in my Sunday best to buy clothes. So I sort of have to moderate my attitude, and I think black women have to do this a whole lot more. I think, at least from what I hear. So, could you tell me a little bit more about that? Like, is I know you don't want to take a side on this, but is this a good tactic for getting good health care, or should we put our foot down, or something like that?
Yeah. I mean, I think this is sort of the catch-22 of what I guess these are sort of the conflicting issues in these debates, right? So you're bringing it up, right? So potentially engaging in respectability behaviors might be sort of a necessary to be able to be taken seriously, even if you don't believe that you should have to do those things, right? And so, I mean, so I guess it's not that I'm not taking a side. I think the issue is, I mean, what I would argue is that we're all sort of engaging in these respectability behaviors to a certain, or people of color and other groups that also deal with marginalization or dealing with having to deal with or forced to deal with engaging in respectability behaviors whether they want to or not. And so that these other discussions are more sort of around, you know, I mean, they're consequential in terms of how people protest and consequential in terms of those things, but that we're doing these things is something we can't change. So we have to change sort of structures. Structures have to change so that they do not have to, so that people don't have to do those things to be able to get good care. But yeah, I mean, it is very real to be concerned about what, you know, how you're dressed and how you talk in terms of how seriously your doctor's going to take you, if they're going to prescribe you with pain medications, if you're actually experiencing pain, etc. So I guess I don't know if people want to weigh in on this. I don't have an answer. I think I just discussed another, you know, like the Bernie Sanders, like I said, another problem. Sorry, I like Bernie.
Verena first and then Noah.
Yeah.
And back.
Could I just add one thing
Yeah,
in
yeah.
response to that?
Yes.
Even though this isn't about my research, but it made me think of research that a graduate student that I worked with, who did her master's in cultural studies at UW Bothell a couple years ago, Dominique Garcia, she did interviews with patients and providers, mainly patients from marginalized racial groups, and she identified this phenomenon that she called gracious patienting, which was basically, so there were patients at clinics serving low-income patients, and often the healthcare workers were like overworked and the clinics were understaffed, and they were running late, and so they weren't always getting the best service. But the patients that she interviewed, and it was a small study, but they weren't like, instead of being like angry, and I mean they may have been angry too, but they were not acting angry. Instead they were being very accommodating and talking about how much they kind of empathized with or felt bad for their clinicians who they saw as overworked or they saw as understaffed, and were actually very gracious about the limitations that their providers were working under. And it makes me think about that as a kind of respectability politics potentially.
I think also with some of the some of it is nuanced because people have so many interpretations of respectability politics. And so, some of this, like, for those of you who study, like, Goffman, some of it leads to, like, sort of presentation of self-issues. And so I think some people who are proponents of respectability politics see this more as sort of a superficial presentation of self-issue. This isn't about your personhood or, infringing upon your freedoms, per se. This is something you need to do to kind of get through the day. So, for example, I think, Randall Kennedy also says in his essay, he talks about Michael Eric Dyson, who hates respectability politics, and he says, Michael Eric Dyson does not wear casual street clothes when he appears on Meet the Press to do ideological battle with Rudy Giuliani. He dresses up because he is rightly attentive to his image, right? So, I mean, like, how do you disagree with that? But does that mean that these are things that people should have to do? And I mean, that's sort of there's issues with that example. But anyway, I think these are some of the sort of nuances to this. I'm kind of like picking up a much bigger, larger discussion and trying to drop in my health stuff, but I think you're picking up on some of the nuances that are definitely there.
That's great.
Karina's going to be next, and then I know I saw a lot of hands with it. So one of the things that I'm really interested in, and I'm not totally sure who I'm even addressing this to, perhaps the room, mainly to Hedwig, but I'm sure it kind of affects some of the other talks. But one of the things we were talking about earlier is the importance, when we're talking about race, health, and justice, to think about what we mean in terms of race. But something that particularly comes up, of course, is to think about what we mean by health. And one of the things I'm slightly concerned about is I feel we have this tendency when we talk about stresses, such as the stresses you're referring to, Hedwig, of constantly saying, and then this is something that people are experiencing constantly, and it leads to these kinds of diseases. And I think it's really important to emphasize that this genuinely has an influence on disease. But I really question the need to even do that, right? Because the very fact that people have these stresses and have this vigilance constantly in their lives, even if it didn't lead to disease, seems to be some sort of problematic outcome, which is maybe not health in certain ways of defining health, and perhaps we shouldn't use the word health to refer to it, but some form of well-being. And sometimes I worry that when these conversations are constantly happening in population health or in public health, that we're actually missing more of a conversation about the fact that that in itself is an injustice and problematic.
It's aesthetic, yeah.
Well, I mean, I think I agree. Other than to say yes, I agree with you. I think some of this is another kind of politics around sort of how to get the attention of other groups who may or may not see stress in and of itself as problematic per se. But I think stress in and of itself is problematic. Yes, like I agree with that. I think we should be more critical about who is part of the health conversation and how we talk about health. I think the population health initiative here wants to be broad in that way in terms of so that other people are in the conversation. I think some people don't think I don't study health outcomes. I don't think that that's actually true. There are a lot of people on this campus who are thinking about things that are consequential further downstream, and they're not engaged in these conversations. I don't know if you have any comments on this. I mean, it sounds like even you, because I mean, you were talking about how your work is completely like right there. You need to be able to do health work, however you define it. You have to be kind of broader.
But it makes me think about, in the context of surrogacy, is the fact that when these ethnographies are done with the surrogates, both in the US but especially in India, you get reportage about people thinking that there's some advantage in being a surrogate. And yet that doesn't mitigate against the reality of the hyper exploitative nature of that relationship. And so even when there are ways of studying conditional choices that are made in those contexts to ameliorate extremely bad situations between a rock and a hard place where you're choosing between one form of unfreedom and another form of unfreedom, you still need to have an analysis of the power structure that's at work there that's setting up those as the choices in neoliberalism in the first place. That one would have to sell their body, or that the choice would be between donating an organ or selling one's womb or letting go of one's child. Those are quite stark choices to have to choose among. And so I don't think that the outcomes question is the only question. I think that the question is a structural question about what kind of analysis of power, racial power, gender power, the power of capitalism do we give in these contexts where we're looking at the forms of dehumanization to which people are routinely subjected.
And also, I guess that speaks to what counts as evidence. Right? What counts as evidence?
Yeah.
I think we can use it strategically. I think it is sometimes deployed strategically to say if we can show that it causes health harm, then people will listen, right? Anthropologists call this like sort of the deployment of what they call biological citizenship. Okay, the state's not listening to me on other levels, but if I can show biological harm, then maybe I can get something, like some kind of recognition or care. But I think that you're right, that we have to be really careful about that. Then do only those measures of injustice matter? And because I was thinking about all of this in relation to prison healthcare, like there's a lot of evidence that incarceration is very bad for your health. Even though sometimes you get more access to healthcare inside than you might out, depending on your situation when you're on the outside. But there's a ton of, very bad things that happen to people's health in prison. But does that, then if we switch it to a health impact question, are we then kind of saying that the incarceration itself is not the problem, which of course it is.
All right, sorry, we had a bunch of questions. We're going to start back here.
I'm just going to stand up because I need to stretch anyway. It might be easier.
You can come up here.
I'm already on the spot. I don't want to walk around the room. So this question is, I think, probably more directed at Alys, but probably like intersects in perhaps interesting ways with the other panelists. I'm really curious about, Alys, when you brought up this notion of Black feminist theory as a philosophy of history. And I love that, and I think you didn't really get to talk to us more substantively about what that means for when we're thinking through these historically constituted categories of health, the historical category of the distinction between the violent offender and the non-violent offender, and how oftentimes like that is itself a racializing process. And I'm wondering if you could talk to us more about what that means. I think especially when we think about, probably just as a question more for Alys, but I'm thinking, for example, of Beyonce's pregnancy, and how a lot of people objected to her Grammy performance on the grounds that, like, why would you be bragging about being pregnant? And it's like, but Black women have always been denied access to being mothers. And so there's something deeply political about the performance of a gendered Black body performing motherhood and not simply reproductive processes. And I think that's a really interesting, intersection here. And I'm wondering if you could speak to more of where these notions of separating the care from the reproduction comes into play here. And same with like the prison, like separating care from maintaining the body alive as we saw in slavery.
Yeah. Thank you. Great question. So the notion of philosophy of history really comes out of the Marxist philosopher Walter Benjamin, and it is the title of one of his essays, and it's a very interesting concept. And what I think he means by it is the capacity to look into the past in order to liberate for the future by working on the present. And I think that he's really talking about the way in which we understand history and the materiality of history in ways that don't produce a progress narrative out of the past, but really allow us to see the ways in which history is recursive and that the violences of the past continue to be present in the present in ways that are often morphed and distorted, but nonetheless remain. And then once we are able to see that, we can work on our present in different ways than we would if we imagined our present as somehow progress out of the past. Mm-hmm. And so I think that what Black feminism does is very intensively return to the site of motherhood and slavery, to reimagine what it meant to have motherhood stripped away, to be forced to reproduce one's own kinlessness, that's Cortez Spillers, right? And to be thrust into a situation where the option of maternity is not open to you as a part of your official identity. And so that speaks to the Beyonce question. And so I think that what's going on in especially Black feminist production starting in the 70s, 80s, and 90s, early 90s, and that's really the period that I focus on, is there's an intensive return to the site of slave sexuality, slave breeding, and motherhood. It's in the form of novels, so Toni Morrison's Beloved and all the other neo-slave narratives that reimagine women's experience in slavery, but it's in the form of Angela Davis's writings, many of which were done from prison, where she's thinking about slave women and their breeding in the context of slavery as a site of insurgency and liberation. It's the book by Angela Davis that was already mentioned earlier today. And so many of these Black feminist scholars are going back to this site of slavery to reclaim something about the experience of reproduction in bondage and sex in bondage in order to imagine the future differently. And that's what I'm calling a Black feminist philosophy of history. And I think Beyonce, in her own performative way, perhaps is doing that. I don't have a reading of that particular performance.
We can talk.
So I talk about respectability politics. I was interestedly drawn into Bell Hooks' attack on Beyonce for the whole Lemonade thing recently, which was very interesting. So, I think, so that's just a beginning of an answer. But, so in my book, there's a chapter called Black Feminism as a Philosophy of History, which attempts to do a tour through many of these writings and understand the ways in which they contribute to this larger philosophical formation, which is actually a methodology for looking at the slave past that centers Black women's reproduction and the question of their insurgency against reproductive bondage and their quest for freedom in that context.
Does it also include loss, discussion of loss and legitimation? I just have to have a discussion of loss, legitimation of loss.
And what kind of loss?
Just loss of the rights to motherhood and how that links to, okay.
Yes, and in fact, I'm interested in the writings that are about women reclaiming their so-called barrenness.
I know we had a lot of questions, so Alright, we'll start here. Hey. So earlier I saw epigenetics on a slide as an environmental factor, and we know that maternal stress can actually cause heritable changes in gene expression in offspring that moderate things like neurotransmitters, right? So stress can be passed down in such a way. And so I was kind of curious if any of you wanted to comment on the power dynamics of like the normalization of stress, especially in the workplace. So one thing I see, I work in behavioral health, and we have a lot of people with symptoms of depression and anxiety that say, oh, well, I don't need to seek care because I don't have it as bad as other people. And so we've kind of like perpetuated this like not seeking care, and then it's also like a reproductive generational thing. So I don't know what's going on there.
That's a big question. Because it made me think of a lot of different things.
Yeah.
Because at least in the, because most of my space is like survey data, and you know a lot of that work, especially work that tries to get at depressive symptoms, usually shows that people of color have lower levels of depression. They sort of, because of the way the questions are, it could be issues with the ways the questions are written. But are you talking about certain populations or just the whole U.S. in general?
Well, like I was thinking about what you said about vigilance, and I think that people who experience vigilance in those practices have maybe been taught to like normalize that, or been taught to just like deal, like that's just part of it. Like I know as a woman in philosophy, right, like I had to do some of these things, like make sure that I was never wrong if I was going to correct a man in class. And I just kind of thought that was normal for a really long time, right? So I don't know if this also is an experience in marginalized communities that experience stress, right? That they're just like socially told that that's normal.
I think that there's some work on this in ethnographic work showing that children are socialized to not that being depressed is normal, but that engaging in these kinds of behaviors is a necessary strategy to be safe, to be successful in school, to not get in trouble, and that not engaging in these things can be problematic. And there are ways in which community members socially sanction people who choose not to engage in those behaviors, and that's sort of the debate I was talking about in some ways. That has implications on mental health outcomes. I think I would argue it seems clear with the literature, knowing that if you agree that this is a chronic stressor, engaging in those kinds of behaviors. The larger question, though, about sort of maybe somebody here does a lot more work on that in terms of like cultural differences and how people interpret depression, how depression should be treated. That's a whole other body and can of worms. That's important and interesting work.
I didn't sit here.
Yeah, but I can definitely give you some citations of stuff I read, but that's not my area. Yeah.
I could also just add that I think, I'm not sure if this is partly what you're getting at, but that stress, I guess encourage us in relation to your question and the conversation in general to think about stress as a culturally constructed category specific to perhaps the US, to biomedicine, and that different places, different societies have different names for different kinds of things, different idioms of distress, right? Different ways of talking about this kind of chronic, what we would call chronic stress. And that may or may not include depression. And again, those are all words that we are somewhat medicalized, and that's fine. But like, I just want to, I guess, not just take them for granted as like that's just they are what they describe, but actually they are constructed categories too. And so it's actually really interesting to look across different contexts and see, well, how are people in other kind of what we would call chronically stressful situations? What are they calling it? And how are they expressing it and stuff like that?
So Sharon, sorry.
Sorry. I would just add a really quick thing to that, because I think part of my retroactively construed purpose here today is to introduce the literary into this discussion. And so one of the things that I would say is that there's such a rich literature that documents the intergenerational transmission of trauma across women over time that speaks to the ways in which people literally embody and express the stresses of living in slavery, under racism, under Jim Crow, etc. So the very first book that comes to mind is Gail Jones' Corregidora, and it's 3 generations of women who all bear children by the same slave master and have to each deal with the consequences of that, as well as their intergenerational relationships among each other. And so really attending to the ways in which these bodies of literature offer us a view onto some of these things that we might want to put into numbers in order to verify its existence, but yet to really feel it and understand it, we might actually need to go to a different place.
Yeah, and I would add to people like Jesmyn Ward who talk about sort of loss and the dimensions of loss that are sort of perpetual and constantly coming. I mean, I think I think she's right that you need to, if loss is part of this discussion, how do we talk about loss? And sometimes the best way to understand that is by drawing from other kinds of literatures, not just looking at the mortality rates for one population group, which is great. I mean, that's what I do, but.
Can I say one book?
Oh yeah, go ahead.
There's a book also that would be very helpful called Cool Pose. Last name Majors of the author, but the book is called Cool Pose. And it's all about that. It focuses on the ways in which African American men sort of respond to these social pressures. And then the cool pose is the idea of the way African American men walk, the way they wear their hats, and all those sort of things. And what the authors just simply argue is that all that performance is a response to the social pressures or to social oppression. And that's their way of saying, I'm not fazed. But really, they are fazed by it.
Yeah. Okay, one more book, sorry. Code of the Street by Eli Anderson, if you haven't read it. Another book that talks about the hypervigilance. There's a guy in the book who talks about how he always carries around his ID card. It was done in Philadelphia because every time he's on campus, the cops will stop him and he needs to show that he has a reason to be on campus, right? So this idea of carrying IDs just to be able to not get in trouble with the police, something that's continues to, like you said, you can look back and forward and still see the same kinds of behaviors sort of being engaged in.
All right, so I saw lots of hands. I know you guys are out there sharing, and then we'll go to the back.
I just wanted to add a comment. While I agree with the comment that that stress by itself is enough, and we shouldn't necessarily even need to be linked to health outcomes. On the other hand, it's very recent in medical education to take an approach that even looks at the relationship of stress to changes in physiology and the intergenerational effects of stress. So I don't want to minimize that at all, because I think that for too long in my work in the educational system where I live, we have talked about the biological reasons why there are disparities between African Americans and white health outcomes, and it's clearly more complex than that, as you've heard from a number of presentations today. And then the other comment I wanted to make had to do with the graciousness of patients in a community health center. I come from community health center practice, and I just want to simplify it, because again, if those providers are mission-driven and very relational, and in fact creating relationships with their patients, that graciousness might be true empathy. So I just wanted to make that comment.
Thank you. All right, in the back, I saw a hand. Yes, I'm sorry, I don't know your name.
So I think my question is primarily for Hetty, but I'd be interested in any of the panelists' responses. And Hetty, I don't know if this is so much as a question as a comment or an observation to have you reflect on, but respectability versus respect versus self-respect versus self-esteem. I really appreciated your presentation. Made me think of a piece by Michelle Moody Adams, a philosopher who has this wonderful article about the social construction of self-respect. And she undertakes an analysis where she weaves through these different comments and talks about the damage that can be done by people wanting respectability, the damage that can do to oneself. And I just wonder if your own work, as you begin to go down this pathway, if you've thought about the differences of wanting respectability versus wanting to be respected, and some of the dangers in wanting to be respected, or the risks involved in that distinction. So,
yeah. I mean, I guess, I thought about it differently, but I guess I was thinking of the converse, in that, to me, it seemed like, sorry, I'm stealing your term. At least from my interpretation of the debates, and obviously they're much more complex than just my interpretation. it seems as though the critique of respectability politics is that quest for respectability, and that one should still be able to garner and receive respect no matter what they do in terms of abiding by whatever the heterosexual Christian morals are that define what is respectable and what's not respectable. And so I guess, I mean, I'd be happy, I would love to hear you kind of flesh this out a little bit more for me, because maybe I'm misinterpreting it, but it seems to me that that's sort of the issue, I think, or at least the argument in that body of work. And I think what's problematic, or not, sorry, I shouldn't say what's problematic, is that despite these conversations that are happening, all individuals who, I would say on average, most people of color are forced to engage in these behaviors, not just for respect, but for safety. And so it's not even about that. It's not just a, I guess that's the turn, I don't know, that's the kind of the turn in the argument, where, people like Randall Kennedy will say, like, if you want to be safe, you have to do these things. If you want to do well, other people saying it doesn't matter what you do. But at the end of the day, people are engaging in, must engage in these behaviors to be safe. I'm sorry, I'm all over the place. I'm thinking about it, but I don't think you can just focus on the respect part. I think that there's the intersection, and maybe, the right to be safe is about respect too, right? Respect of your body and your life, I guess.
No, but I think your point about safety is absolutely right.
Yeah.
Hence my admittedly, somewhat overly, obtuse remark about the risks involved in demanding to be respected as a human of equal moral worth versus demanding respectability. Respectability according to what? To majority norms.
Exactly.
Right? So anyway, it sounds to me like you're moving, and I'll send you the article.
No, I would love to read it, and I mean, because I think it is at the end of the day about respect. How we define and think about respect is sort of short-sighted, depending on who you're talking to in these debates. How this then is actually, how people actually enact this in everyday life is sort of the question, is the next question, right? So, is this sort of an argument that we're having that's actually about what people are doing? Are we having these arguments about, how people should be and should not be? Are these things actually things that are enacted anyway? Or do we have this Brittany Cooper say this, but at the end of the day, when she's teaching her classes, she's gonna, have to do the kinds of things that were talked about. At the end of the day, when she's walking down the street, she's gonna have to worry about this. Does she still suffer the health implications of dealing in a world where you have to play the respectability politics game to be safe? Anyway.
Can I add something to
Yeah.
that? So I think that in white intellectual communities, a lot of these things, self-respect, being respected, self-esteem, they all get muddled together. And at some point, there's a sort of abjection that happens, that takes hold. You sort of feel like you hate the thing that you are, and so you become something else. And in philosophy, there's a cult of genius, myth of genius, that sort of manifests as the need to be clever. I think you had a quote that spoke to that. Yeah, that's right. Makes sense. And so at some point you start to do, it becomes almost reflexive, but it also becomes so internalized that if you're not doing it, you feel like you don't respect yourself. If you weren't clever enough in a seminar or a classroom or somewhere else, or even around your friends and family, you lose self-respect. And I guess I want to parse all of those concepts out, but I don't know if I can.
I should mention that the paper I presented is part of an article in Souls that was co-edited by Relina Joseph on respectability politics. So she has it's a great, tons of really great articles in there where people are approaching Relina Joseph in Souls, in Du Bois, where people are approaching respectability through different disciplinary lenses and how it's manifesting, and maybe doing some of the stuff, answering the question better than I can probably.
So we are technically out of time, I'm very sorry, but we do have a coffee break, so feel free to get rid of